Welcome back everyone, Dr. Naveen here from UPSC MEDICO. So we are discussing UPSC CMS 2025 solved paper. In this video, we will be focusing on subject preventive medicine. So there are 40 questions in paper 2 of UPSC CMS. We will try to find the right answer for these questions, and the discussion would be very brief as I would be focusing on why the given option is correct. So more detailed discussion videos will be uploaded in the UPSC CMS course by UPSC MEDICO. Now coming back to the question number 1, which one of the following is a major contributor to the total energy intake in terms of energy provided in an average Indian diet? See, if you take the diet as a whole, the predominant component of Indian diet is carbs, right? So the carbohydrates they provide, they are the major contributor of total energy intake. So the answer here is carbohydrate. Sometimes we tend to get confused based on per gram supply of energy. For example, if you take proteins will provide approximately 4 kilocalories per gram. Similarly, carbohydrates will also provide 4 kilocalories per gram, whereas fat provides 9 kilocalories per gram. That's the reason students got confused that it may be fats, but fats is wrong because per gram it is 9 kilocalories per energy. But overall, the main source of energy in Indian diets, because we take plant-based food, right? We don't take animal-based food because animal-based food contains a lot of protein. Plant-based food contains a lot of carbs, right? So carbohydrate is the main source of energy. Almost 80% of energy in the body is contributed by the carbohydrates. Okay, almost 50 to 80% of our diet contains carbs, and almost 80% of the energy we get to the body through the carbs in India. Right? Vitamins, they are micronutrients. They are not energy, or they don't form the bulk of the food. They only provide extra functions. We all know what is the function of vitamins and minerals, but they are micronutrients per se. Right? So the correct answer is carbs. Now let's go to the next question. Now consider the following with regards to amino acids. So the first and the second question, these are from the nutrition part of the syllabus, and every year like almost 3 to 4 questions are coming from the nutritional part. 3 to 4, and lot of focus is on amino acids, and last few years they have asked a lot of questions on what are essential amino acids and how they are different from non-essential amino acids. What is the basic difference between a plant-based protein from an animal-based protein? What is the best protein available in the diet? Like egg is considered the best protein food, right? So we will look into all these aspects with the help of this question. Now let me read the question. This is a multiple completion type question, and this time around, let me tell you, PSM, almost all 40 questions, there's no surprises, and many of them are PYQs. In fact, in UPSC CMS exam, this time in 2025, most like if you take subjects as a whole, PSM is like the easiest one among all, right, so far. Now essential amino acids are those that body cannot synthesize and they must be obtained from dietary proteins. Absolutely right. Not just essential amino acids, non-essential amino acids are also needed by the body for synthesis of tissue proteins. Right? See, both essential and non-essential, they are needed for synthesis of protein. But the former, that is essential amino acids, we should eat from diet. The non-essential amino acids are even synthesized by the body. So even statement 2 is also correct for me. Unless a protein contains all essential amino acids in amounts corresponding to human needs, a protein is said to be biologically incomplete. Absolutely correct. Because if you want to call a protein as biologically complete, it should contain all the essential amino acids, and milk and egg proteins are biologically complete. Okay, usually milk and egg proteins are biologically complete. Animal proteins are rated superior to vegetable proteins because they contains more quantity of essential amino acids. So this is also correct. So this question, they're asking you, of the above statements, how many are correct? Almost all 4 pairs are correct. All 4 options are correct. So I would go with answer 4 for this particular question. Now next question is, which of the following strategies were encouraged by UNICEF in GOBI? We all know GOBI. G is growth monitoring with the help of growth charts. Okay. O is oral rehydration, that is ORS, which we use for mild to moderate thing. B means breastfeeding, B means breastfeeding, and I means immunization. So this is a child safe strategy. GOBI strategy is a child safe strategy designed by UNICEF. The main intention is to help or to bring child health revolution. There are 4 strategies in this. There is a new strategy which may be important for next few competitive exams or next year exam. That is, we have even GOBI triple F. Okay, apart from growth charts, oral rehydration therapy, breastfeeding, immunization, we also have 3 F's. That means female education is one entity, and next thing is family birth spacing. Okay, family spacing or birth spacing, and very importantly food supplementation. Okay, food supplementation. This is again WHO plus UNICEF has designed this. So we are not only focusing on child, even female education, family spacing and food supplementation to the female are also an important components which will reduce neonatal and infant mortality rate. So UNICEF, WHO, GOBI, triple F. So G is correct, O is correct, I is correct. B is not better evaluation of children. It is breastfeeding. So the correct answer with this question is 1, 2 and 4. So option 2 is correct for this particular question. Now next, this question is from environment. Okay, what is the limit of daily exposure of noise that people can tolerate without substantial damage to the hearing? Okay, what is the daily hearing limit or daily limit? Usually when people whisper, okay, when people whisper, we have a decibels of 20 to 30. In a normal conversation, the sound will go up to 60 to 65 decibels. In heavy street traffic, we get a sound of 60 to 80 decibels. You know, in boiler factories which are noisiest, boiler factories, later on occupational health disorder is sensorineural hearing loss. The sounds will go up to 120 decibels. Now, a daily exposure of 85 decibels is safe. Okay, we can tolerate. So that's why if you use Apple watches, any one of you, if it exceeds more than 90 decibels, they'll give a warning. Okay, but 90 is not the number. As per Park Preventive textbook, it is 85 decibels which is the daily limit. Sorry. So the correct answer is option 2. So shall we move to the next question? Yes. Next question. How much illumination is recommended by Illuminating Engineering Society for the general office work? All these questions are value based, little difficult for an aspirant who is seriously preparing for NEET PG and ACT, wherein concepts are asked more, but here important tables from standard textbooks are the dictums for CMS exam, right? So we measure illumination with a unit known as lux. Okay, and this Illuminating Engineering Society has recommended some limits, okay, which should be there for usual tasks. So when I talk about a task, that is, I am talking about a task that is a visual task to read, that means a casual reading. I need to have an illumination of lux. What is that? 100 illumination. So in this question they have asked about general office work. So for a general office work, I need an illumination of 40 lux, whereas for fine assembly, okay, for fine assembly, bigger assembly, 900. For any very severe intense task, okay, very severe task, we need 1300 to 2000 lux. And you know, watch repair, watch making, wristwatch or this thing, so they need highest amount of light to be able to see the micro things, that is 2000 to 3000 lux. But for the exam point of view, the question is general office work, they're expecting you 400 lux. So the correct answer here is option 3. Now the next question is dietary fiber, an important one. Dietary fiber these days is gaining importance because it is also energy producing. We were discussing energy by carbohydrates as 4 kilocalories, right? It's given in latest PARC that even dietary fibers, they'll give energy 2 kilocalories per gram, but in the same PARC textbook of PSM, they have given that dietary fibers have no metabolic effect. Okay, they do not have any metabolic effect. So the correct answer is option 3. Though in somewhere around that, given that now there is a controversial discussion that dietary fibers also offer some energy, but there is no anabolic effect as such. They do not produce any metabolic effect in the body. The dietary fibers do not produce any metabolic effect in the body. Okay, yes. So the next question again from nutrition. If you go to this exam by reading nutrition, you will be able to attempt at least 4 to 5 questions correctly, right? And egg proteins are considered to be the best among food proteins because yes, they have high biological value, they are easily digestible, and very importantly, it is biologically complete. That means it contains all the essential amino acids, right? Biologically complete. This is one area. And apart from that, their calorie content is higher than in proteins or veggies. It's not about calorie content. So the correct answer is 1, 2, 3. Now on a chest radiograph, which of the following occupational diseases is most likely to be mistaken as tuberculosis of the lung? You know, there is a condition known as silicotuberculosis. People used to think that because they have similar presentation in the chest x-ray, most of the time they thought that it is because of TB, but when we do some sputum examination or other tests which are important for TB, it was found out that this is not TB. That means silicosis is mimicking tuberculous kind of features. So that's the reason for the correct answer for this particular question is silicosis, because it is closely related to tuberculosis. What is the characteristic X-ray presentation, X-ray chest appearance of silicosis, which is most of the times asked in the exam? It is snowstorm. It is snowstorm appearance. Very important, one of the frequently repeated question. Apart from that, when you talk about silicosis, it is progressive disease. People with silicosis are prone to develop pulmonary tuberculosis, and we call it as a silicotuberculosis condition. Okay, so when you look at radiological picture, sometimes you might mistake it as TB. So that's the reason the final answer for this particular question is silicosis, right? Let's move on to the next question. So which variety of asbestos is associated with mesothelioma? You know, even I was like, when I first learned that, most of the times in occupational lung disorders, examiner always revolves around two conditions. One is silicosis and other is asbestosis. So you know what is silicosis per se? Is silica. You know, even asbestosis is also a silica. It is also a silicate. Right? Don't get confused. Even asbestosis is also made up of silica, but it's a commercial name. Along with silica, it contains lot of other fibrous material. So asbestos is a commercial material, it's not a natural element. Silica is a natural element available in sand. If you mix that with the available fibrous materials, like what you can mix with magnesium, you can mix with iron, you can mix with calcium, you can mix with sodium, you can mix with aluminum, anything you can use. Right? So if based on the varied compositions, now this asbestos, I'm talking about asbestos, not asbestosis. Asbestosis is a commercial name given for a mixture of silica and other fibrous material. When we mix them in different combinations, we get two different types of asbestos. One is serpentine variety, also known as chrysolite variety, or serpentine or chrysolite variety. The other variant is amphibole. The other variant is amphibole, serpentine and amphibole type. Now this amphibole is again divided into three different types. Now you have crocidolite, you have amosite. You have to remember this because they asked a question on this. Anthophyllite. These are the different variants of asbestos. So in this crocidolite is blue, amosite is brown, and anthophyllite is white. Now this crocidolite which I am talking about, this is the entity which is associated with mesothelioma. Right? So that's the question. So the correct answer for this particular question is crocidolite, that is option 3. The variety of asbestos which is shown to have a strong association with mesothelioma is crocidolite, which is blue, and it is again amphibole entity, amphibole variety. Good to go. So let's go to the next question. Now under biological waste management, I think they can ask tough questions also, but they have asked a simple question, that is, Human anatomical waste is yellow. So I'm not discussing this in detail because discussing biomedical waste management itself will take 30-45 minutes, right? I have uploaded a detailed 45-minute video on biomedical waste management in our UPSC CMS course curriculum. Okay, go to the website. If you're part of the course, you can access that in detail. But yellow includes human anatomical waste. Very simple question, baseline question. And one question which is frequently repeated, okay, in the UPSC CMS. Let's take, there are 10 topics which are most commonly repeated. Among them comes physical quality of life index. They'll just copy paste this question every year, each and every year of UPSC CMS exam. I don't know the reason, but yes, people tend to confuse, like it's purely memory based, and most of the time students might be like marking these questions wrong because it is memory based. That's why they are doing that. So PQLI, physical quality of life index, has three indicators. One is life expectancy. This is not at 0 year, it is at 1 year, life expectancy at 1 year. Option 2 is correct. Apart from that, physical quality of life can also be judged by infant mortality rate. Very important. This is also right, option 1. Apart from that, education is important, right? That will also decide your quality of life. So literacy. It's not about per capita income. There are people who are richer than an average man, but still their quality of life is not good. So money is never a matter. It's all about health and also education. Okay, it's not about money. That is physical quality of life index. Now 1, 2, 3 is the right answer for this particular question. Now let's go to question number 12 of UPSC CMS PSM discussion. Simple. Which one of the following terms is all or none phenomenon and is best described as termination of all transmission of infection by extermination of? So they're talking about eradication of the disease. You know, so far we were able to eradicate only one disease, that is smallpox. Okay, there are some diseases which are eligible for eradication, like measles. Maybe in the future we might eradicate. Maybe in the diphtheria we're close to eradication. Polio is eliminated, not yet eradicated, and guinea worm. So these are potential for eradication, but the definition which is given, all or none phenomenon, is about eradication of the disease. Next question is, what are the objectives which are set forth for different units and subunits, each of which prepare its own plan of action, usually on a short-term basis? So objectives. So I am talking about here, this question is from this particular question which we are discussing is the health management methods. They're talking about health management methods. Among the health management methods, they are classified into two entities based on, one is quantitative methods, the other is methods based on behavioral sciences. Methods based on behavioral sciences. So this is important. So among the methods based on behavioral sciences, one method is management by objectives. One method is management by objectives, that is MBO. So the question is based on the same thing. What is management by objectives? It is based on behavioral sciences. You have objectives which are set forth for different units and subunits, each of which prepare its own plan of action, usually on a short-term basis. So this helps in achieving the results more effectively and smoothly. So the correct answer is management of objectives. Even if you apply some common sense, they're talking about objectives which are common in both these options. We have other options. There is a detailed discussion on health management methods which I have covered in the course. So I'm not getting into the details. It's a time consuming process. But for here you need to understand that management by objectives is a method based on behavioral sciences. Okay. So next question is, Panchayati Raj is a three-tiered structure of rural local self-government in India. We all know this, right? We have Panchayati Raj system. They have 3 levels in village, block and district. Now consider the following like Gram Sabha, Gram Panchayat, Nyay Panchayat and Panchayat Samiti. Among them, which of the following bodies are present at the village level? So this is the question. So they are asking a question on health systems prevailing in India, and one of the village level health system, that is one of the 3-tier system of Indian health system, is in the Panchayati Raj. We have at village, at block and also at district level. When I talk about village level, we call it as Panchayat. When I talk about block level, we call it as Panchayat Samiti. Then when we call about district, we all know it is Jilla Parishad. Now, Among these three, the village level is again divided into three different entities. One is you have Gram Sabha, you have Gram Panchayat. If you are from a village, you might have heard all these names, okay? And we have Nyay Panchayat. Now in this question, they are only asking about village level three things: Gram Sabha, Gram Panchayat, and Nyay Panchayat. Gram Sabha, Gram Panchayat, and Nyay. See, Panchayat Samiti is at block level, so this is wrong. So the correct answer here is 1, 2, and 3 for this particular question. Now many patients, next question is, many patients with unexplained rash, fever were reported from a village close to primary health center. Now you are investigating an epidemic. So what are the 10 steps of investigating an epidemic is important even for theory exams as well, right? So there are many steps which are important in investigating an epidemic. The first step is, first you have to identify the disease. That is, you have to verify whether it is the correct diagnosis of a disease. First, verification of a diagnosis. When diagnosis is confirmed, next comes you have to confirm, that is confirmation of existence, that is confirmation of existence of an epidemic. That means you need to know whether an epidemic is existing or not. Next comes you have to define population at risk. Then comes rapid search. You have to rapidly search for cases and controls. Then comes data analysis. Then you have to formulate hypothesis. Then after formulating hypothesis, you have to test it. After testing hypothesis, you have to evaluate for ecological factors to find out the cause. Once you know, then we have to further investigate at risk population, and finally we have to write a report. These are the steps. So in the exam, in the question, they're asking you what is the first step in initiating the investigation of such an epidemic. So the first step is always and always verification of diagnosis. The correct answer is option 2 here, right? The correct answer is option 2. Now next question is John Snow's discovery that cholera is a waterborne disease. It is an ecological study, so it is a natural experiment. So answer 2 is correct. So John Snow, he has conducted natural experiment to identify the reason behind cholera is it's a waterborne disease and it is polluted water, right? This is one important thing. There are other studies which may be important for exam point of view, maybe in for future CMS exam. That is, the Richard Dahl has conducted a study on study on smoking plus lung cancer, and this is actually cohort study. Similarly, Edward Jenner, you might have heard this name many times, Edward Jenner, who has created smallpox vaccine, Jenner's vaccine, okay, Jenner's strain. It is an experimental trial. Right? Now James Lind is also there. He has conducted study on scurvy and citrus fruits. Eating citrus fruits is used to cure scurvy. So this is again a clinical trial. So these are the 4 experiments which are given in Park textbook in the ecological part. So the natural experiment part is John Snow's discovery that cholera is a waterborne disease. Now very simple, you have to calculate sensitivity and specificity. Only one calculation based question have come this time. Usually they tend to ask 3 or 4 questions. They're asking you to confirm whether sensitivity and specificity are correct. Both are correct here. So how do you calculate sensitivity? Sensitivity is true positives divided by true positives plus false negatives. So what are the true positives here? 45 dc. This is true positive. Okay. Now this is false negative. So this is 45 divided by 50 into 100. That means sensitivity is 90%. So specificity is opposite. Now you have false positives and true negatives. So specificity is true negatives divided by true negatives plus false positives. That means you have to divide 32,000 divided by 40,000 into some 100. That means it gives 80%. So sensitivity is 90, specificity is 80. Okay, 1 or the 2 mathematical calculation questions will come in the exam, that too from the screening part in the PSM part of the UPSC CMS examination. Now next question, let's quickly jump to Question number 19 of set C of UPSC CMS exam. Simply they're asking you vitamin A deficiency. Did I miss a question? Yes, question number 19 we have to discuss. We have a data obtained from hospital records, but the problem is hospital records data is not direct representation of sample of population. What are the reasons? See, in hospital setup, the main drawbacks of hospital data are the mild cases may not even attend the hospitals. Even subclinical cases also they won't come. So that's the reason. So this is correct answer. Population served by a hospital usually cannot be defined. Yes. Cost of hospital care is not recorded. It is actually recorded. So this is wrong. Admission policy for cases can vary from hospital. This is also right. So these are the three strong reasons why we cannot take hospital records as a numerator or a denominator. So the correct answer is 1, 2 and 4. Of the following ocular manifestations of vitamin A deficiency, the first sign that can be clinically seen, see, the vitamin A deficiency, it manifests as dry eye, otherwise known as xerophthalmia, dry eye or xerophthalmia, and we all know this, right? But within that, there are various stages of vitamin A deficiency. So what are the various stages? We have first and foremost, the first symptom you see, first symptom complained by a patient is nyctalopia, or the patient will say that it is difficult to see in the evenings, that is night blindness, is the first symptom that you see in a case of vitamin A deficiency. This is followed by the first clinical sign, not symptom but the sign, is conjunctival xerosis, that is dryness of the conjunctiva, conjunctival xerosis or dryness of the conjunctiva. That is your correct answer, because the first sign they are asking, not symptom. You might confuse with symptom and you might mark nyctalopia, but it is conjunctival xerosis. Apart from conjunctival xerosis, bite-out spots can be seen, one area where a lot of questions might come, or even corneal xerosis can develop at a later point of life, or this is followed by even thinning of the cornea, that is keratomalacia, a dangerous condition wherein globe perforation can have liquefaction of cornea. It's a medical emergency. Actually, it's a grave ocular emergency. Eye collapses and vision is lost with keratomalacia. These are the 5 stages, but first symptom is night blindness, first sign is conjunctival xerosis. If you know this, you will answer this question correctly. Now, bony deformity, pigeon chest, we all know, vitamin D deficiency, rickets. There are other deformities as well which are beyond scope of the discussion. They're pretty easy. You can check model answer in the course. Okay, so rickets, pigeon chest. Now, this question is little tricky. We're talking about index of thermal comfort. We have corrected effective temperature is considered to be improvement over effective temperature. It deals with which of the following factors is the question. So let's try to learn this in little detail. What I'm trying to tell here is, when you look at temperature, okay, we have 2 parameters. One is effective temperature, the other is corrected effective temperature. Okay, I'm talking about index of thermal comfort. I have 34 degrees, I have 32 degrees, I have 31 degrees. That is not index of comfort. Just temperature is not index of comfort. There are other parameters you need to take into consideration. Apart from air temperature, sometimes if you go to England, even if the temperature is 32 degrees, based on humidity and based on air velocity, we call it as air movement, they feel if there is a cool breeze, okay, it is fine. But if you go to coastal area, even if it rains, even if the temperature is 21 degrees, because of humidity and all, you might not feel that thermal comfort. So that's the reason the other parameters comes into picture. Effective temperature is not just air temperature, it is air temperature plus humidity plus air velocity. Now to this, if you add one more parameter known as mean radiant heat, if you add a parameter known as mean radiant heat, that is radiant temperature of the surrounding surfaces also, the surrounding surfaces, if you add that also, that will improve the effective temperature. Then we call it as a corrected effective temperature. Okay, so I'm not only talking about air temperature surrounding, even I'm taking temperature of the surroundings which are covering the surfaces which are covering the environment. So in that area, mean radiant heat is corrected effective temperature. So I'll be looking at air velocity, I'll be looking at humidity, and on top of that I'll be looking at mean radiant heat. 1 2 3. Sweat rate is not at all related to, is not at all an index of thermal comfort. Now this is, we all know lapsed immunization is an important topic in PSM examinations from immunization board. A lot of the times they're asking questions on lapsed immunization. There is a very good important table in PSM Park textbook wherein they have given it clearly. They said vaccine and age limit. This table is very important from exam point of view. So I'm talking about a vaccine, that is BCG. The maximum age limit is 1 year. You cannot give a BCG after 1 year even if the patient presents later. If it is hepatitis B, the maximum age limit is again 1 year. If it is OPV, the maximum age limit is 5 years. If it is measles, the maximum age limit is 5 years. If it is vitamin A also, the maximum age limit is 5 years. If it is DPT, the maximum limit is, you can give it up to 7 years. Now in this question they are asking two things, DPT and OPV. The maximum age limit for DPT is 7 years, OPV is 5 years. So the correct answer here is option 1. Simple. Based on this table you have to answer these kind of questions. Okay, let's move a little quickly. It's taking more time than usual. So we're still solving question number 23 now. Okay, so yellow fever vaccination travel guidelines is a PYQ. Last year also they asked a question on the same topic. Now they are saying there is a traveler who has passed through a yellow fever endemic zone and does not possess a certificate of vaccination against yellow fever, and he is entering into a yellow fever receptive area like India. Okay, and for how long from the date of leaving the infected area must this traveler be placed on quarantine in a mosquito proof ward? Okay, so the mosquito proof ward, the quarantine period is 6 days. Okay, and after giving certificate, after taking vaccination, the certificate is valid after 10 days. After 10 days of vaccination, the certificate is valid. Right, done. This is last year question, but this is the latest question. That is 6 days is the quarantine period required for yellow fever. Now under the ESA Act 1964, if sickness of an insured person is duly certified by an insurance officer, periodical cash payment benefit is payable for a maximum period of how many days in a continuous period of 365 days. The sickness benefit is 91 days. Very simple question. So many times this question got repeated. The sickness benefit is 91 days. The benefits of ESI Act is important for CMS exam. Very important. Now consider the following statements. Wernicke's encephalopathy. Oh my god, like hundreds of times this question has come in various entrance examinations. Thiamine, Wernicke's encephalopathy, and Korsakoff syndrome. So it is not niacin. So 2, 3, 4 are correct. We don't even need to look at this part because this is like most frequently repeated question, right? Now next, a housefly transmits any infectious agent by which of the following methods? Housefly is mechanical. It's a mechanical transmission. So the option 2 is correct. There are various transmission systems by vectors, right? So in medical entomology, arthropod-borne diseases can be transmitted by direct contact, or they can be transmitted by mechanical transmission, or they can be transmitted by biological transmission. So when I talk about direct contact, I got a classic example, that is scabies and pediculosis. When I talk about mechanical transmission, we have our very own housefly. Now when I talk about biological transmission is again divided into propagative. Let me take a different color to avoid confusion. It is propagative is one. Next is cyclopropagative is other. I'm not telling you what these are in detail. Let's try to learn examples because detailed discussion anyway will be there in the regular course curriculum. Now propagative is all about propagative. The classic examples are plague. Cyclopropagative is malaria, that is Anopheles, right? Mosquito malaria. Now cyclodevelopmental is filed. Just remember these classic examples because many of the times in entrance examinations I'm seeing questions on these parts. Okay. Now next, in a case of 7-year-old school-going child, what would be the most appropriate indicator to measure the current nutritional status? It is weight for height. Birth weight, it is too early, right? Mid upper circumference in the toddler age group, head circumference during the infantile stage. So weight for height is the parameter which is most appropriate indicator to measure the current nutritional status. In the nutrition part of PSM, they have clearly given the age group and also. So to measure maternal nutrition, the indicator is birth weight, right? To measure infant and preschool, the indicators are weight for age, or weight for height, or mid upper arm circumference, or clinical signs and symptoms. But for school child at the age of 7 years, the best thing is either height for age or weight for height. So the weight for height is option given here. This is the classic table given in PSM Park textbook from which this question is asked. 7-year ongoing school children, we check for weight for height. Even with common sense, you can answer this. See, home-based newborn care and home-based care of young are important topics from which questions frequently get repeated, and this is under ASHA. So the main person involved in delivery of HbA1c is not ANM, it is actually ASHA. Okay, so this option is wrong. It helps in early detection, yes. It helps support the family, yes. It's the aim is to improve the newborn, yes. All these are basic common sense. 1, 3 and 4 only are correct. It is not ANM, it is ASHA who is the main person involved in the delivery of home-based newborn care. The next question is, they're asking you sex-linked recessive diseases. Sex-linked recessive, cystic fibrosis is autosomal recessive, so this is wrong. DMD and color blindness are X-linked recessive. Even retinitis pigmentosa sometimes is X-linked recessive. So this is correct. 1, 2 and 4. So modes of inheritance, the classical examples, autosomal dominant, X-linked dominant, X-linked recessive. Every year one question is coming from the genetics and health part of PSM. So it's an important, frequently repeated question. Now under which name National AIDS Control, NACO, Suraksha Clinics, very easy. Now we have a latest strategy known as Sampurna Suraksha strategy. Okay, so it's Suraksha Clinic, NACO. NACO is Suraksha Clinic. So correct answer is option 4. Which one of the following essential amino acids is usually the limiting amino acid in most of the pulses? You know, there is one question recently last year in UPSC Civil Services Examination, Medical Science exam. They have asked a question on what is the supplementary action of a protein. So when I read that, I felt it good, because in India, we eat vegetable proteins, vegetable based proteins, and vegetable proteins are inferior to animal proteins because they contain less amount of essential amino acids. If you take rice per se, we have all the essential amino acids except lysine and threonine. And if you take pulses, the pulses are rich in all essential amino acids except methionine. But if you club them together and eat rice dal rice, then what happens? They will compensate for each other. So this is known as supplementary action of proteins. Cereal proteins are deficient in lysine and threonine. Pulse proteins are deficient in methionine. So he's asking the same question. The pulse proteins is deficient in methionine. Lysine and threonine, these are deficient in case of rice. When you club them together, there is a supplementary action. That's how in India, even we predominantly eat vegetable based proteins, still we do not have deficiency manifestations of essentially amino acids, because we club them and combine them together as a culture. Okay. Next. Which of the following are defense mechanisms adapted? It is defense mechanisms is not a question from psychiatry. This is given even in medical sociology part of PSM textbook. So they have given around some 10 different defense mechanisms. Among them, they are talking about rationalization, they're talking about projection, they're talking about regression, they're talking about escape mechanism. And there is also displacement, not replacement. So this is displacement. So correct answer is 1, 2 and 3. What are the reasons for choosing coliform organisms as indicators of fecal pollution rather than waterborne pathogens directly? So when we check for water pollution, we can go for coliforms, we can go for other waterborne pathogens also. Clostridium and all. But we'll never choose Clostridium over coliforms, because coliform organisms, they're constantly present in great abundance. They're in great abundance in the human intestine. They're easily detected by the culture methods. They survive longer than other pathogens. That's the reason, not lesser than. This is longer than. You know, they are also highly resistant to forces of natural purification. That's why even if there is a purification process, they remain and they indicate the intensity of the fecal pollution of the water. So these two are wrong. So 1 and 4 are correct. That's the reason we use coliform organisms for assessment of the fecal pollution of water rather than the waterborne pathogens directly. Right? Because they are present abundantly in the intestine. They have a higher resistance to forces of natural purification. They survive longer than other pathogens. They are easily detected by the culture methods. Now, Ministry of Health and Family Welfare has recently launched a program on prevalence of anemia. This is WIFS, weekly iron folic acid supplementation. There is supplementation of 100 milligram elemental iron and 500 microgram of folic acid. Yes. And these iron supplementations in WIFS, what I am talking about, the WIFS program, or we call it as a WIFS blue program, because it is a blue campaign wherein blue tablets are given, and the target age group is 10 to 19 years, and they are given weekly iron folic acid, okay, with the help of a fixed day approach, right? It entails supervised administration of albendazole 400 milligram every 3 months. No. It is biannual deworming. Only 2 times in a year. Biannual deworming, albendazole 400 mg 6 months apart. Right? So this is wrong. So the correct answer is only 1 and 2. This is again an important question. National Framework for Malaria Elimination 2016 to 2030. We have different deadlines for this particular program of NFME. NFME, the objectives are 2022 it is different, 2024 it is different, 2027 is different, and 2030. The closest for us is 2027, because we are living in 2025 right now, right? So 2027 is we have to be able to prevent indigenous transmit of malaria should be interrupted, and entire country should have no indigenous cases and no death due to malaria. So the option 3 is correct. Entire country has to initiate process for certification of malaria elimination status. No, this is not 2021 part. All states and UTs must establish fully functional malaria surveillance to track, investigate and respond to each case. This is to be achieved in 2024. So this is also not right. Okay, all states must reduce API to less than 1 case per 10,000 population. This should be achieved in 2024. Okay, so this is the third option is 2027. Okay, so the certification is 2031. So the different years to which this NFMP objectives should be attained. Now next question is under very important PMSMA, Pradhan Mantri Suraksha Matritva Yojana, 9th day of every month. Voluntarily the private medical practitioners should go to a government health facility and they should offer ANC facilities. In our UPSC MEDICO YouTube channel, there is a detailed video on PMSMA, which is a new scheme. The new schemes in maternal care by Ministry of Health and Family Welfare are PMSMA and Suman scheme. Even Suman scheme is also important, can be repeated in entrance examinations. Okay, PMSMA and Suman scheme. PMSMA is 9th day of every month. The care or concern should be done. Okay. Now next question is small for date babies, also known as small for gestational age babies. They weigh less than what percentile of the gestational age? See, things can't get simpler than this, right? It is 10th percentile. 10th percentile. In most widespread calculation of stillbirth rate, numerator is defined as fetal deaths weighing over 1000 grams at birth during the year. So what is the correct value of X? Little tricky, because in the mortality and morbidity indicators, we learn a lot about fertility indicators, maternal mortality, neonatal mortality, infantile mortality. Never we worry about stillbirth rate, but stillbirth rate is, the numerator is fetal deaths weighing over 1000 grams. So the correct answer is option 3 here. Now while performing triage in response to disaster emergency, an internationally accepted 4 color code system is used. Okay, disaster management, many of the times questions are repeated in this aspect. You have category 1, 2, 3, 4 of disaster management. In that, category 1 is red, category 2 is yellow, category 3 is green, and black. Black is almost like it's dead. Okay, black is almost like dead. That means moribund patients, right? Black is moribund. Moribund and dead patients, least priority should be given. Okay, because they are unsalvageable. Green means they can walk, ambulatory patients. Okay, non-threatening injuries, so don't worry. Yellow is high possible resuscitation, life-saving surgery is required in these cases, but highest priority should be given for red. Red means high priority. So the correct answer for this question is red. They are asking which one of the following 4 characters represents highest priority. Highest priority is red. Right, now we have last question from PSM. Consider the following statements with regards to ice-lined refrigerator employed for storing vaccines at sub-district level. Okay, so this question comes from immunization part, that is cold chain. You know, ILRs are ice-lined refrigerators is an important link in the cold chain. Okay, they maintain a cabinet temperature of +2 to +8 degrees centigrade. You know, they are lined by ice and they have a top door which is open. Why top door is open? Because if there is an air, if the door is on the top, it will not escape. You might have seen ice cream parlor fridges. They have a top door, not a front door, because for ice creams not to melt, frequently the ice cream in the parlor, they open the door frequently, so that will lead to escape of the temperature, right? Escape of the cold temperature. So to prevent that, the air will circulate. If it is top door, the air will circulate. If it is a front door, the air will escape, right? So that's the reason these ILRs have a top door. They maintain a temperature of +2 to +8 degrees centigrade. So these are top opening, and they are maintain +2 to, and they are divided into 2 parts. Based on the temperature, they are divided into 2 parts. You have a top zone and a bottom zone. The lower part is cooler in comparison to the upper part. Upper part is less cooler in comparison to the lower part, because cooler air is heavier and it will settle down the bottom. Now all vaccines should be kept in the basket provided with ILR, not on the floor, because risk of freezing is there. Never put the vaccines on the floor. Now the upper part is cooler compared to lower part. No, lower part is cooler compared to upper part. This is wrong. And based on the temperature zone, inside of no, 2 parts only, upper and lower. This is wrong. So 2 and 3 are wrong. So we are left with 1 and 4. So the fourth option is vaccine should never be kept directly on the floor, because if you kept directly, they will be frozen and they get damaged. They should always be kept in the baskets which are provided. So this is correct answer is option 4. So this will conclude our PSM discussion part of UPSC CMS.